ask the machine to add an enzyme called heparinase. I think which counteracts the action of the heparin in the sample. So, patients on a filter, let's say, on a bit of heparin. You put this heparinase, you put it in the machine. It'll give you a trace of what the blood would be like without the heparin. How cool is that? That's cool. So you'll know, so you can compare, your sample before you put the heparinase with the sample afterwards, and see the traces. If the traces are different, if the first trace with without the heparinase is abnormal, and the second trace with the heparinase is abnormal, then you'll know that the reason the patient was bleeding is because of the action of the heparin, and all you need to do is to give the patient protamine to reverse the action of the heparin, and you solve the problem. You don't need to start wondering, do we need to give cryo? Do we need to give FFP? Do we need to do? Are they bleeding? You'll know exactly what it is, and you'll know it really quickly. So that's the first sort of mind map that we've got. I've got a second one here. Just basically summarize everything I just said before. Why would we even consider using TEGs? They reduce the risk of accompanying transfusions, because transfusions, even though we screen the blood, even though it's quite safe to have blood transfusions, it's still quite a little bit of a risky thing, because you might get a reaction to the blood. Some blood products are harvested from many individuals, like to make a unit of cryo or FFP or something. Sometimes these samples these products have to come from quite a few individuals, so you can never absolutely rule out the potential for shock and other complications. So if you can reduce, do without transfusion, then might as well do that. And this machine will help separate the cases that genuinely need transfusions to those that don't. There's also a shortage of blood products which we can cut down on, and it overcomes the limitations of standard tests which we were talking about before, which are basically the fact that these tests are not accurate. Apparently the guy who was giving us a talk at Glenfield was saying that these tests weren't actually designed for what they're used for now. They're actually designed for something else, but we've started using them to test the coagulation of blood. So whereas this is specifically designed to test not only the dynamics of the blood, but also the kinetics of the blood coagulation. So what are the advantages of using TEGs? They monitor hemostasis as a whole dynamic process, not just a static process. They are not isolated as conventional tests. They measure, how do we measure them? Well, they measure the viscoelastic properties of the blood. How do they do this? What's how does the whole process work? Okay, we'll get into that. Okay, a sample is taken from the patient, just like we take blood gases. It's made to clot in an environment similar to that of sluggish blood flow. Okay, the sample is recorded by the machine as it clots. So you take a small sample of blood, put it in the machine, and then the process starts happening, which is recorded. The shear and elasticity of the clot that starts forming from this sample are recorded. The time and rate of the clot forming from this sample are recorded. the strength and durability from the sample that is put in the machine are recorded. Why do we record this? What's the point? To see if the patient is likely to keep on bleeding, to diagnose why patient is bleeding, to help establish a solution to the bleeding. Yes. Alright, the third one, actually this one is a better one than the one I just showed you, but we'll get into it again. Tags. Okay, the machine itself, we'll talk about the machine. The machine is called a computerized Thromboelastography coagulation analyzer, and you saw the picture of it before. It's a nice little compact machine which you can put right next to the blood gas machine, and it can be kept on the unit and can be used by all nursing staff once they've been trained and signed off as competent to use it. It can be connected to the computer, which will obviously have the software that goes with the machine, and the computer is the one that the software is the one that analyzes the data and then plots the graphs. As you can see from this picture over here, we've got the sample there. This is like schematic showing the sample, this little cup here, and this is the blood, and this pin descends into the blood. You see, descends into the blood and then starts spinning round and round and round and round at I think 10 cycles, a minute or something. And then this rotating axis here, it says rotate, it starts rotating from side to side at 4.75 degrees, left and right, right? And while it's doing that, can you see these little lines here? Okay, these are fibrin strands and platelet aggregates between the surfaces. Okay, between the surface of the cup and the surface of the pin. See, and in the meantime, this little cup is being heated as well, right? So as it does this, as it spins and moves on its axis, these little clots start forming, and this detector here sees, oh, it's starting to clot, and then starts recording on the graph, when the clot starts forming. You see, and then once the clot is formed, it sort of stabilizes, and then once it starts breaking down, because the clot it's not going to last forever. Once it starts breaking down, it starts recording it as well on the graph. That's why. So we know, imagine now, we've taken the sample like from the patient like 2 minutes ago. You put it in here. This is live, whole blood. It hasn't been spun around in a centrifuge. It hasn't been messed about with. It's the blood straight from the patient. This is what the patient is. It's pretty much like blood gas. It's fresh from the patient. It's like a real time sort of indicator. That's the benefit of this machine. The normal values are indicated as dotted lines, so it's pretty much like a blood gas. It shows you what the normal ones are, and it shows you how much of a deviation you'll have on your sample, or how normal your sample is. The method